Loretta, I think you're mute. If you're speaking to me, I can't hear you.
I am. And I thought you weren't coming. So I already removed you from the program. Can you imagine?
Really? I sent a mail saying that my phone, I had issues with that phone. I now dropped another number you could reach me with.
Oh, I didn't know. I didn't know. I'm happy. I'm happy that you're here.
Same here. Good to see you.
Yes, this is me. This is me. Okay. So I have to redo this. So what I put up was
so sorry.
Yes, what I put up as a topic for you was the role of health management offices. Is that okay?
Okay.
How do you want it coined? I want it the way you like it.
Okay. That's fine. That's fine. Yeah, it's okay. You can handle it like that. Yeah.
All right.
That's okay.
All right. So I have to retype it now.
Okay.
I'm glad to see you. I was really worried.
Sorry about that.
Yeah. Rebecca, you're welcome. My engineer.
Hi. Hey.
You're welcome. So,
how you doing?
Fine. So, Ma, how do I address you? Yeah. Yes. Should I just say representative from Hijia HMO?
I guess I'm the only HMO person in this
meeting. Yes, you are.
Or are there other HMO?
No, you're the only one, Ma.
Okay. Okay, all right. Just wanted to be sure about that. That's fine.
Okay. All right. Okay, let me call you on phone. You're all welcome. We'll soon start. Sorry, Ma, please kindly send the phone number again. I want to call you on phone.
Okay, I'll do that.
Yes, ma'am. So you're all welcome to the meeting. I'm happy that we are all gathering already. That means we are all excited about the topic for today's meeting. Okay. Good evening, everyone, and welcome to today's meeting, Health Hangout with Dr. Ada. First of all, I would like to thank God. Some of my friends don't believe in God, I keep saying, but I do believe in God. I want to thank God for the opportunity He has given us to gather here to talk about our health and what we can do to improve it. I am a medical doctor, a senior registrar in pathology, and that is anatomical pathology. And we see a lot of preventable deaths and a lot of patients coming, with illnesses that could have been nipped in the bud. And because of that, I felt, it was necessary for me to join the bandwagon of those who are campaigning for preventing ill health, being a part of the health advocacy team in the whole world. So this started actually when I realized that some of my relatives and friends were coming down with illnesses like cancer and so on. So I decided to form a group where I educate my family and friends, get my colleagues and other health practitioners to come and talk to them. Along the line, I realized that my family and friends have their own family members and have their own friends. And so it started spreading. And please kindly mute your phones, okay, so that we don't interfere. Okay. Okay, so okay. So that was how this whole thing started, and then it kept spreading. So today, we had a first meeting where we talked about breast self-examination about 2 months ago. And then we repeated it later. Today, we are Today, we are talking about health insurance. Initially, we're going to take just health insurance in Nigeria. Well, of course, there are a lot of health care programs or opportunities that are not available in Nigeria. And because of that, Nigerians also seek health care outside this country. So we have people coming in from different parts of the world. We have somebody coming in from the USA, Australia, United Kingdom to tell us how we can actually get healthcare in those areas. So you are all welcome to the program today. And I'm glad to hand over to the moderator of this program. I am Dr. Ada. I'm the convener of Health Hangout with Dr. Ada, and you're welcome. I want to hand over to the moderator, who has been a very consistent volunteer, very encouraging, Engineer Rebecca Ekuke, to take it off from here. Thank you very much and welcome once again. I will now make her the host.
Hello. Hello, everyone.
Hi.
I hope you can hear me. Yes, I muted everybody so that there's no interference of noise, but you all have the ability to unmute yourself. So you can unmute yourself if you want to say something, but everybody at the moment is muted. So my name is Rebecca, and today I'll be working with Dr. Ada in hosting this meeting. And so we have a couple of guest speakers for today's meeting, and I'll be introducing them to us so that gradually the guest speakers can start talking and giving us the information they have for us one after the other. So the first guest speaker we have, for me, I'm a guest speaker as well as a moderator, and I'll be talking about my experience with health insurance in France. My name is Rebecca Ekuke. Then there is the coordinator of, there's the NHIS State Coordinator, Lagos State, Nigeria, who will be in person of Mrs. Aisha Habubakar. She's going to be talking to us about how we can all get insured, health insurance. And there is Chinonye, who will be talking about the role of health management offices, that's HMOs. She works in an HMO organization and will be telling us about how we can, the role of health management offices in Nigeria. Then we have the senior consultant pathologist, Dr. Obata, who will be talking about how he insures his parents. And I think that's a good thing for all of us to know, because parents need more, in fact, they really need more healthcare than younger ones. So it's always nice to know how your parents can be insured. And then we have Dr. Ukakwe Hannah, who will be talking about health insurance in the UK, her experience, as well as how Nigerians can have access, if there's anything like that, can have access to UK health insurance system. Then we have Dr. Uzamaka Anosike, who will be talking about, she's a nurse based in the US, and she'll be giving us her experience with health insurance in USA. Though that session is a recorded session because she's based in the US and there's a lot of time difference. So we will be giving a recorded session of her experiences, as well as Engineer Baksho Soso, who will also be giving a recorded session of his health experience in Australia. So I hope you guys enjoy this meeting, and yes, so we'll call on the first guest speaker to start. Dr. Adam.
Okay, thank you, Engineer Rebecca. So the first guest speaker for today is actually the NHIS boss. She's the state coordinator for Lagos State, Mrs. Aisha Abubakar. I don't know if she's here present.
Mrs. Aisha Abubakar.
Okay, she needed some time to pray, so I don't know if she's done. If she's not done, I can see that, Rebecca, can you give us in 5 minutes your experience with health insurance in France?
Okay, thank you. So I'll start since I'm already here so that we can save time. So I will be talking about my health insurance experience in France. So I am a student in France, and no, I'm not a student. I was a student when I came, and I've been here for 3 years now, 3 years in France, first as a student, and then I got a job as an engineer, and now I'm working as an engineer. So in France, when I first came, it's important that it's a French law that anyone who is going to stay more than 90 days in the French territory is obliged to have an health insurance policy. It's compulsory by the French law. So once you're staying past 3 months, you need to have a social security number and you need to be insured by the French government. But if you're staying for 3 months, maybe you have your health insurance from your local country, you can use that. And for the 3 months you'll be staying, if you're staying for less than 3 months, you can use your health insurance from your local country. But as long as you're staying more than 3 months in the French territory, you must be insured by the French government using the social security system. And so, yes, all French citizens by default are insured, and anybody staying more than 3 months in the French territory must be insured by the French government using the social security numbers. So visitors can be insured, but if they are going to be staying less than 30 months, by the way, I have a list of questions here that Dr. Ada sent to me, and I'm just answering those questions so that you guys can know how the health insurance in France works. And please, if you have any question, do not hesitate to ask at the end of my presentation. So yeah, in France, every visitor staying less than 3 months is not obliged to be insured by the French government. But once you are staying more than 3 months, you are obliged to be insured by the French government. And for me, who has a health insurance here in France, I can use my health insurance to insure my dependents as well. Say I have maybe a sister who is a dependent who wants to come from Nigeria to France to come and visit. My health insurance is able to cover her. But I need to have a legal status for my health insurance to be able to cover my sister. I need to have my social security and all those other things for my health insurance to be able to cover her. Yes. And in France, no, in France, I saw what Dr. Ada said. Once you're staying less than 3 months, you're not obliged to be insured by the French government. You could use your own insurance from your home country, but you are obliged to have at least a travel insurance to come into the French territory as a visitor. And you can use the travel insurance from your home country. But once you're going to stay more than 3 months, you must get the French social security, which is the French health insurance. Yeah, just to clarify what I am saying. And now, who pays for health insurances in France? People working pay for the health insurance. Taxpayers' money pay for health insurances. Like when you work, your employer takes part of your money and gives to the government for your social security, for your health insurance. But the good thing is that that money covers 60% of your health insurances, because the French social security only covers 60% of health insurance, while the 40% is either covered by you personally or you get an extra private health insurance to cover the remaining 40% for you. But by default, 60% of your health insurance is already covered by the social security of France. So my health insurance can cover, can your health insurance cover visitors from other countries? Yes, as long as I have a legal status and as long as the person who is coming is a dependent to me. Yes, my health insurance can cover the person. If not, the person is obliged to get a travel health insurance. The merits and demerits of being insured, I don't really think there's a demerit of being insured. I think health insurance comes with so many benefits. I'll even give you a very personal experience of mine. Some months back, I think in July or so, I got hit by a car when I was coming back from work. And glory be to God, I had a health insurance. Getting hit by a car is something I never thought would happen to me in France. In fact, I never thought in my wildest dream that I'll ever be hit by a car, especially in France. Maybe if I thought I'll be hit by a car, I thought that would happen in Nigeria, not in France, considering that people here are more careful when they drive and all. But to my surprise, I got hit by a car, and then my health insurance came in very handy because the ambulances had to take me to the hospital. I had to do a brain scan to make sure I didn't have internal injuries in my head. I had to do a chest scan as well. And I had to do some other scans to make sure that vital organs were not injured. And those things cost money if I was supposed to pay from my pocket. But I had 60% paid by the government, and I had 40% paid by the complementary health insurance, because the French government, like I said, only covers 60%. The remaining 40% is covered by either you yourself or a complementary health insurance, which I have. So 100% was paid by the health insurance, and I didn't have to pay a dime, even for getting hit and for all the scans I did all over my body, which would have cost so much money. So I think health insurance is so important because there are so many things in life you cannot control, and anything can happen at any time, and then you don't want to pay such money out of your pocket. If not, it can get you bankrupt. And my personal experience with health insurance. So here in France, say for example, I don't feel too well, I call my doctor, because every person insured with a social security must have a doctor. like you must have a personal doctor. It is compulsory, and it is your personal doctor who will recommend medicines for you to buy. Because if, say for example, I'm sick and I don't have a personal doctor, I risk not getting compensated or not getting reimbursed after paying for something. Because there are two ways to this thing. I could go to the hospital, pay from my pocket, and then the government reimburses me, or the government directly can pay to the doctor or whoever is treating me. So say for example, I do not have a personal doctor, I risk not getting reimbursed after paying from my pocket. So it's always necessary to have a personal doctor in France. They call them médecins traitants. So when I'm sick, the first point of contact is my doctor. I book a rendezvous with him, I book a meeting with him, because here you cannot just walk into the hospital no matter what is wrong with you. If it is an emergency, there's an emergency line to call. But if it's not an emergency, then you have to book a meeting with the doctor and go on the day of your meeting. So say for example, my tummy is paining me really bad. Today is a Saturday, or today is a Sunday. Doctors don't work on Saturdays and Sundays. So if it's really bad, I can only call the emergency, which is 112. But if it is not that bad, if I can wait till tomorrow, I get a meeting and I go see the doctor tomorrow. Then the doctor examines me. If it's something he thinks I need to get a scan, he will write a paper, I don't know what they call it, but they write like a treatment you need to do. And I take that paper that the doctor gives me to the hospital or to a laboratory. Let us say I'm supposed to do a blood test or something. The doctor writes it as like sort of like a prescription. I take the paper to the laboratory, and the laboratory asks for my card vital. That's like my social security number. They do the test for me for free. And then the result I get, I take it back to my doctor. My doctor analyzes the result, tells me whatever he thinks is wrong with me, recommends drugs for me. Now, when he recommends the drugs, I take this paper back to the pharmacy, and the pharmacy gives me the drug for free. So that is, but all these things are paid by the health insurance, not by me. But when you look at it in hindsight, I've actually paid, because the tax collected from my salary goes to the health insurance. So that's just how
Thank
the
you,
health
Rebecca.
insurance in France. Yeah.
Thanks. Because of time, I think we should call in the NHIS boss. Thanks for telling us about health insurance in France. We started on a good note.
You're welcome.
Thanks a lot. So
Yeah.
permit me to invite her. She's the Lagos State Coordinator of the National Health Insurance Scheme. She's a very fantastic woman. I've never met her. Somebody referred me to her and told me that she is passionate about NHIS in Nigeria. And the first call I put through, I was able to confirm that. She is Mrs. Aisha Abubakar. Mrs. Aisha Abubakar is here in the house with us, and I would like her to take up the role of health insurance, the NHIS part. I want her to tell us how every single Nigerian can be insured. So Mrs. Aisha Abubakar Haruna, you're welcome, ma'am. Thanks, Rebecca.
Yeah. Mrs. Aisha Abubakar, please, can you unmute yourself?
Hello, good afternoon, everyone in the house. Good to have you.
Good afternoon.
Good afternoon and welcome.
Thank you for having me. Hello.
So we can hear you, ma'am.
Hello, good
Yes,
afternoon,
I
ma'am.
think there was a break in between while you were introducing me. I don't know, I'm having some fluctuation here. That's why I asked before you even call me in if anybody's experiencing the same there.
Okay, ma, you're welcome, ma. Go ahead, we can hear you clearly.
Thank you so much.
Yes.
Yes, can you go back? I only heard you introducing me. Have you asked any question?
No, I haven't. So we want you to just tell us how everyone in Nigeria can get insured, whether you're in the federal service, state service, a private person in business, and so on. Thank you, ma'am.
Yeah. Okay, thank you. It's a great thing for me to be here and to talk to you all about the National Health Insurance Scheme. The National Health Insurance Scheme is a social security system where we expect people to come together to contribute a pool of funds to provide for affordable and quality healthcare services for the Nigerians. But I know one of the major challenges we are having in this country is that most people do not want to make payment for services that they are not getting right on the spot. So getting people to insure for health has been a major issue and challenge for us, in the sense that many people will ask you, why am I paying for something? What if I don't fall sick? But the thing is that when it comes to health issue, nobody can tell, just like my sister mentioned earlier, when it's going to happen and how it's going to happen and where it's going to happen. So the National Health Insurance Scheme is a way of the government trying to reduce the out-of-pocket payments in accessing healthcare services. We have over 70% of out-of-pocket expenses being used for, getting healthcare services. But when you get insured, you are sure of having access to, healthcare services at the point it is needed without paying out of pocket at that point in time, because you've already paid money in advance. For Nigeria, we started with the formal sector program, and I can tell you that over 95% of the civil servants in Nigeria working in government are all insured. And we have other programs that cover the informal sector, because we know that in the Nigeria population, we have over 69 or 70% that are in the informal sector. So recently we launched a program that we call GIFSHIP. The acronym for GIFSHIP stands for Group, Individual and Family Social Health Insurance Program. Under this program, anybody can come in, whether individual, whether family, whether a group, whether small, medium enterprises. Any companies having at least 50 employees and above can come in under the GIFSHIP program. How does it work? GIFSHIP can come in as an individual, like I mentioned before, and it's just 45,000 naira for individual. Under this individual, you are entitled to have 2 direct family members coming, bringing them in under your cover for that 45,000 naira per annum. And this gives you access to selecting a facility of your choice, whether from the public or the private sector. And whenever any of these families fall sick, you have access to, get treatment from that primary healthcare services. You are not limited to that primary healthcare services. If there is need for any specialized care, here you can upgrade to a secondary care giver or a tertiary, as the case may be. But there must be clinical reasons for you to migrate to getting access at the secondary or tertiary level. Then we have the family. The family stands for 4 and above to 9. For each of these members of the family, you are entitled to pay just 15,000 naira, depending on the number that is coming in. Let's say about 6 people in the family want to register under the health insurance. It means that they will pay just 90,000 naira per annum. And the beauty of this is that you don't necessarily have to be in the same location for you to pick a hospital. If for instance, the man is based in Lagos and the family are in Abuja, the man is entitled to select hospital for the family there in Abuja. And let's assume they are not all based in Abuja, some are in Port Harcourt. You are also entitled to select hospitals for those family members that are in Port Harcourt. This is under the family. And like I said, family is between 4 and 9, while individual is 1. We call it individual because you come in as an individual, but you're entitled to have 2 family members to come in under that 45,000. Then we now have groups. This is where we are talking to people, small enterprises, business owners, to ensure their workers under the group social health insurance program, and it is the same 15,000 naira depending on the number of groups in that company. And it is also a right for each of the member of the group to select whichever hospital they want to use when they need care. Now, the question is, how come people don't know about health insurance? I will accept that we are still having that challenge of, reaching out, but this is one thing we are picking up as an organization right now. We have been doing a lot of campaigns, sensitization. If you have been following us on NTA, we have a program that is going on a weekly basis where we're sensitizing people. We are going out to places like companies, marketplaces, name it. We are doing this sensitization, but one of the problems we have in Nigeria is this. Insurance is not what we abide with. I was kind of envious of my sister speaking about France, where people pay, whether they need it or not, where the rich, you pay for the poor. Why those who are healthy, they pay for those that are sick. But here in Nigeria, somebody will tell you, why will I pay for health insurance when I'm not sick? What happens if my contribution is not used, I don't visit the hospital? But they forget the fact that there are times that when something strikes, it will wipe up every contribution that you may have made, which means other contributions are going to be used to provide the healthcare services for that person. So I will say that if we all put heads together to make people understand that health insurance is the way to go in Nigeria, the reason is that we need to have a pool. Once there is a pool, you know that whenever anyone falls sick, there will be access to funds to provide the needed health services for that person or for that group of people. Then we also have to look at the service providers and the facilities. The facilities cannot continue in business if they don't have the finances, to carry on providing services. And it depends on the number that are coming under this contribution that you expect that this facility will have the needed funds to equip their hospitals, to provide consumables, to provide healthcare services, and even the specialized areas. These are people who are specialized and they need equipment, they need the needed equipment to provide whatever screening or diagnosis that they need to carry out. But when we are having very few people participating in this field, where do we expect the funding? We all know that the government cannot provide everything needed in health services. The only way to go is coming under the NHIS, where everybody will come in together. Like the gift ship will say, no, leaving no one behind. We're expecting that everybody can have access, everybody can contribute, and everybody could have affordable and quality healthcare service just by paying 15,000 naira, depending on the category that you fall in. So I can say that the National Health Insurance Scheme benefit package, quote me, is one of the most elaborate benefit package you can find in any health insurance that is being practiced across the world. Why do I say this? Under this package of gift ship, for instance, a pregnant woman is entitled to having antenatal care throughout the 9 months. Delivering is covered. And even when it has to, go for a cesarean section, it is covered under the 15,000 naira. And the child is entitled to 3 months postnatal care after delivering. And thereafter, we expect the mother to bring the child on board. Under this 15,000 naira, you are entitled to access quality healthcare services from your primary provider. And when there is need for you to have specialized care, you move to the next level of care. And I agree, and I'm sure my sister will agree with me that in France, you can't just walk up to having access to secondary care services or tertiary. You are going to be booked for some months or weeks. But here in Nigeria, you just walk into your primary provider and they find out that, oh, this person needs to be seen by an ONG. And the next thing, the person is referred through the HMO. Mind you, under the health insurance scheme, we affiliate you with an HMO of your choice under this gift ship. We have over 53 accredited health maintenance organizations we call HMOs. Once you come in and you are doing your registration, apart from selecting your hospital, you are also entitled to select your HMO. The HMO are like, let me use a middleman between the enrollee, the facility. So whenever there are needs for a referral, it is this HMO that will call the facility to provide authorization code. This 15,000 naira is where we pay admin fee to the HMO for providing these services. And within this 15,000 naira, an enrolled Nigeria will have 21 days cumulatively hospital stay, meaning that if you come in this month of December and you happen to visit your facility and there's need for you to be admitted, and you're admitted for 3 days, it means that for the entire 12 months that you are registered for, you are now left with 18 days under the 15,000 naira. Under this 15,000 naira, you are entitled to having access to your prescribed medications whilst you are walking out of the hospital. And the only time that we expect you to pay a token is at the point of collecting your drug from the pharmacist, that you pay 10% only on the cost of drugs. 10%. The reason why this was introduced is to provide control against misuse, where somebody will take off a health insurance card of another person and want to access care with it. So that 10%, we call it co-payment, is for the patient to pay to the pharmacist and obtain a receipt, nothing more. As far as the patient and the facility abide to the limits of our benefit package, except where the patient decide to say, oh, for instance, you are entitled to stay in a general ward for admission under the health insurance, and you decide to say you want to be in a private ward, then you are expected to pay the difference, because we don't provide private ward. But basically, I will tell you that the benefit package of the NHIS it covers the basic need that we expect anyone to have or to need when visiting his or her facility.
Okay, thank you, Ma.
You're welcome.
Thank you for that detailed introduction of NHIS and especially the voluntary scheme.
No,
people are asking.
We no longer do voluntary. It's
okay.
V-ship. When you call it voluntary,
okay.
When you call it voluntary, then we are making it sound, oh, if you like, you can come. If you don't like, we are not saying it should be made compulsory. And I can assure you that the bill has passed through the National Assembly, is waiting for the president's assent. And we are expecting that once it is made compulsory, where every Nigeria will contribute to that pool, I tell you, we're going to have an improved healthcare system delivery in Nigeria.
Okay, so people are asking for the name of that package, because that was the main reason I wanted it to come up. So I typed V-ship, V-S-H-I-P. I hope I'm right.
No, please. No, please. V-ship was our former program, which has been reviewed and was launched November 2020. I'm going to type the acronym now, if you will enable me.
All right, ma'am, please do.
It's called GIF ship.
Weapon now.
Acronym.
Stop
and
that.
I'm going to give you the full meaning. It's called GIF ship. The G is group.
Okay, so she's giving us that now. If you can't send it on the group, she can send it to my WhatsApp message, and I'm going to post it on the group. Thank you so much once again, ma. Okay, GIF ship. I think we can all see it now. You see, I've even learned something today. I'm even old school too. So
yeah,
I'm
there's
glad
nothing
we
like
have
voluntary anymore. There's nothing like voluntary anymore.
Yes.
Yeah, I'm typing the full meaning of GIF ship.
Okay.
Yeah.
Okay. So I want to thank her for coming up for this meeting today. We have other participants, and we would have loved them to take just 5 minutes each. They are coming from all over the world. So I'll hand over to the moderator to call up the next presenter. Thank you so much again, ma.
Thank you for having me.
Can you mute your phones too?
I think somebody has a question on the group chat for Dr. Aisha.
Okay.
Somebody asked a question. Somebody said that was from Izine's Galaxy. She asked that she wants to find out the current laid down restrictions placed on pregnant women as isn't it, if you can hear me, please, do you mind asking your question again? Because I cannot really understand what you wrote on the group chat.
Na Samuel Ananonti.
Okay, yes, is that Izine here? Izine is Galaxy. If you don't mind asking your question to Dr. Aisha.
Please, go ahead.
Okay, I know that there's some form of restriction placed on pregnant women as regards access to private use of private NHIS. Because I tried accessing it. Sorry?
Yes. You mentioned private.
Yes, the one that they pay 15,000 per person, 45 for 3 people.
Yes.
Yes, I recall trying to use it at some point, and they said you are supposed to have registered. After 3 months, your NHIS number will come out, and after 6 months of use, then you can now access it for delivery. So I wanted to get like clarification from you on how that works.
Okay, that is not what the exact thing. The fact is that when you're coming under the health insurance scheme, it doesn't mean that when we register you today, you immediately start accessing care. No, it takes minimum of 90 days for us to bring you on board. And this is to give room for us to affiliate you with your HMO, your care facility. Of course, you know, insurance, for you to be able to sustain the program, you don't expect people just register today, boom, and they get into the facility and they start accessing care. So that room for 30 days, 90 days does not affect in any way your validity subscription. When you talk about 6 months, when we had voluntary social health insurance program before it was reviewed to GISHI, what we were getting were adverse selection. People who are needing surgery at the moment will just come and take the health insurance, and once they're done with their surgery, they are off the scheme. And this left the business to have issues. The facilities were having issues. They could not sustain, providing these services. And what we now said was that before you can come in to have surgery, you must have spent 6 months with that facility. I don't know if you are getting me. What we're getting is people that want to do fibroid, people want to do all sorts of surgery. They just come and pay 15,000 naira. The moment they are done with the surgery, they don't renew their program. So we brought in these changes in order to sustain the program and to also provide better services. And I want to tell you that under this GISHI, people are entitled to do CT scan and MRI. Under this 15,000 naira, but this is a 50-50 payment system where the patient pay 50% and the HMO on behalf of NHIS pay 50% for that patient. So when you're talking about surgery, it's not that you're not entitled to surgery, but we are trying to put a control whereby people just come in and take the health insurance package just because they want to do surgery, and the next day they walk away. So I need everybody to be clear with this. We provide surgery, but it has to be after you have spent 6 months with that facility. You will agree with me that if you run a facility and 10 people just come in this month, and the 10 people want to carry out surgery for 750 capitation that we are paying on your behalf to the facility on a monthly basis, my dear, this will not help the health sector system. So that's just for further clarification.
Okay, thank you.
And when you talk about restriction for pregnant women, there's no restriction. Like I said, the pregnant woman is entitled to antenatal care and is entitled to delivery, whether it's vaginal delivery or CS, the patient is covered. But we do not want a woman to walk into NHIS when she is 9 months or 8 months and want to deliver and walk away. You have to come in at maybe first trimester at most. So the problem we are having is people are not really understanding what health insurance is all about. That is a system of which you pay a token expecting that when there is need for it, not when you need it now, and you just come and wipe up the contribution of other people. So we should be very clear with this. Thank you.
Thank you very much, Dr. Aisha and Izini.
I'm not a doctor.
Okay,
I'm not
thank
a doctor,
you.
Please.
Thank you very much, Mrs. Aisha. Okay, now We're going to, the next speaker that we have now is Mrs. Chinonye. She's going to be talking about health, the role of health insurance, health management offices, the role of health management offices. So Mrs. Chinonye, please, if you're there, you can have the stage.
Okay, thank you, Rebecca. Good afternoon, everyone.
Good afternoon.
Can you hear me?
Yes, we can.
Okay, thank you. I'll not be showing my video because the network is very poor, so I'll just do the voice, if you don't mind.
Yes.
Thank you, Mrs. Aisha. You've done a very wonderful job with the introduction. So I've got little or nothing or more to say. So what is HMO? HMO is Health Maintenance Organization.
Organization, yes.
Yes. HMO is Health Maintenance Organization that offers health insurance plans in conjunction with network of healthcare providers. So like Rebecca mentioned, my name is Chinoya and I work with Hygia HMO as a business development manager. So I'll be taking us through on what we do for individuals. So we have health insurance is actually for everyone. Like Ms. Aisha had said earlier, the problem in Nigeria is a lot of us like to fit out things. We're very religious people, so Jesus is my insurance keeps happening. God, I will not go to hospital. In the last 10 years, I've not been to the hospital and all that. But when the need arises, you see people running helter and skelter looking for ways to pay their hospital bills. So that's what the HMOs do. So with NHIS, is government owned. With HMOs, you have private health insurance companies, which Hygia HMO is the first registered HMO in Nigeria. We have over 30 years experience in the HMO space. So we try to provide this affordable healthcare services for our enrollees across Nigeria. So what we do, we have plans for retails, that's individuals and families. We have plans for SMEs, that's for small and medium scale organizations. Then we have plans for corporate organizations as well. So there's plan for everyone. And I'd like to mention that we also have plans for senior citizens plans. These are plans for our aged parents, our relatives that are well over 60 years, up to 85 years. So you agree with me that as we get older, there's need for us to have access to health plans to take care of our health needs. So in the HMO space, we're able to provide all those services. In Hygia, to be specific, we have all those services all those plans that you can buy into and have access to these services. Just to mention that with Hygia, we have a roaming service, so we do not tie you to any hospital. We have over 1,500 providers across Nigeria. And immediately you come onto our plan, you have access to all those hospitals. Just to mention that our retail plans, like I had mentioned earlier, is for individuals and families. So we have a retail plan that goes for 47,000 per annum. So after that payment, you have access to inpatient benefits, outpatient benefits. Inpatients, I mean, those services that if you go into the hospital, you have to be on admission, you're not leaving the same day. Your admission, your feeding while on admission, and surgeries, all those things that will require you not to leave the day you walk into the hospital. Those things are called inpatient benefits. So the plan gives you access to those benefits. It gives you access to outpatient benefits as well. Outpatient benefits are those that you access and you leave the hospital same day. So if you need to see a GP, you need to see a specialist, all those diagnostic tests that you need to do, you also have access to medications, chronic medications for those that have pre-existing conditions like high blood pressure, diabetes, all those things are covered under the plan. So you have access to medications that will help you manage those ailments and those conditions on a monthly basis. Like I mentioned earlier on, you pay a premium, an annual premium, and it gives you access to a plan or to the benefit for a year. I also want to mention that we have what we call the high mat plan. This specifically for maternity, for pregnant women. So it gives you access to delivery, both normal and CS. It also gives your child access to health care in the hospital in the first 1 year of the baby's life. So the baby has access to health insurance in the hospital he or she was giving birth to for a whole year if you buy the high mat plan. I know I have 5 minutes, I'll try, and I don't know if the 5 minutes I've already used it up, so I'll just try and summarize what I have to say. So in summary, our plans give you access to, okay, for the retail plans, the individual plan, you have a 2 weeks moratorium, so 2 weeks waiting period. Like Ms. Saisha said, people mostly run to health insurance companies when they have the need for it, but that's not the idea behind it. So, however, if you register for the retail plans, you have to wait for 2 weeks. But the good thing about the corporate plans that you have access to care immediately. Corporate plans are from 21 lives and above. And we have the list plan at 26,000 per individual for the list plan. So these are some of the things we offer in Hygia HMO. I can take your questions and we'll take it up from there. Thank you, Dr. Ada.
All right, thank you, Noye. Sorry, engineer. I also want to mention that Hygia is one of the top 10 HMOs. And I want to say that I reached out to 10 of them. They were the first to respond. So it shows you how committed they are to making sure that we Nigerians are all insured. Thanks for coming, Noye. They will also send in some questions in the chat box. Please kindly address them because of time. We want to take the next guest speaker. Thanks again.
You're welcome.
So thank you very much, Mrs. Noye. So right now, if you have your questions, please just put them on the chat box. If you have questions for Mrs. Noye, please put them on the chat box and she'll respond to them at the end of this, towards the end of this meeting. So the next speaker we have right now is Dr. Obata. He's a senior consultant pathologist and he's going to be telling us how he insured his parents. So please, Dr. Obata, if you're here, please, you can have the stage.
Yes, thank you very much, Rebecca. And thank you, Dr. Ada, for inviting me to the program. I don't know if you can hear me. Can you hear me, Rebecca?
Yes, we can hear you.
Okay. Yes. My network is not very good, so I will use only the audio. I may not turn on my video. So I'm operating from a village where the network is not very good. So thank you. Health insurance is very good. I got to register my parents when that was after my mom had a fracture of the right femur. I work with SMC Moya, so I'm under health insurance myself, and then I registered my nuclear family. So as at then, I didn't know I was supposed to. I could register my parents, so I didn't have that information. So not until my mom had a fracture and I took her to the hospital, she had a surgery, she had a wrist, so full reduction and internal fixation with some implant. And so she spent, because she's elderly, for that reason, she spent a long time in the hospital. And at the end of the day, I paid through my noses. So it was during her stay in the hospital that other colleagues informed me that I could register my parents under me. And so after that, I had to register them on that means. So as at then, I think I paid 9,000 naira for each of my parents. That's my dad and my mom. And so they are under me. They are my dependent. They depend on me. So I register them as my dependent. So that I think I pay. Then I pay yearly for the two of them. Then also I have because at some point I had to travel out of the state, and so for my residency program, I had to travel out of the state. So because there won't be anybody around to move them to the hospital in the city where I registered them and all that. So I had to make a local arrangement with a hospital in my town where they could also get treated. That hospital is owned and run by a consultant, ONG, where he also employs the services of other doctors, other specialties. So I made that arrangement with that hospital in my town, because it's very close to my my village where my parents reside. So while I was away outside the country and outside the state, so they assessed that hospital in my town under a local arrangement, like an insurance arrangement. So by that, the trouble of running up and down was relieved from me. All they had to do was to just go to that hospital whenever they had any health issue. So that is that about my parents and their registration with national health insurance and the local health insurance in my town. Thank you very much. Don't know if there is any question.
So thank you very much, Dr. Ogbata. Really appreciate. So basically, Dr. Ogbata used a local hospital, from what you said, near your parents, right?
So I use a university teaching hospital for national health insurance.
Okay.
Because there was a time I was away for like 4 years, all right, from the state, all right. So because there won't be anybody to move them from the village to where the hospital is located in the city. So I now have to make that local arrangement. It's a different local arrangement, like an insurance scheme. It's local with a hospital in the community, in my town, my village town, my hometown. The hospital is there. All right. So if when they have minor ailments, they go there. But of course, if there is any major ailment that needs me to come down home to move them to the hospital, the university teaching hospital where I registered them, because that's where they're going to access care. So like I said earlier, I didn't know that I could register my parents until my mom had that fracture that she spent a long time in the hospital following surgery. And I had to pay through my noses. I had to pay the bill through my noses. So that was when I got to know about. So most of us, even in the health sector, we do not know much about this health insurer. So I thank Aisha for that information, because a lot of things I also learned from her that I didn't know earlier. Thank you very much.
Okay, thank you very much, Dr. Ogbata. If you have any questions for him, just leave it in the chat box, please. He'll address it at the end of this meeting. So the next person will be calling up is Dr. Hannah. She's going to be telling us about her health insurance experience in the UK. So Dr. Hannah, if you can hear me, please, you can go ahead.
They should also introduce themselves too.
Okay.
Hi. Yeah, I'm Hannah, one of the senior surgical registrars here in the UK. I've been here for some time now, and I also have a master's in health policy with the LSE, health policy and financing with the London School of Economics and School of Hygiene. There's a joint course I did with them. So in terms of NHS, we know about NHS. NHS has been or was and is, and I believe will continue to be, a health insurance that was made to provide health to everyone, free of charge at a point of need, irrespective of their socioeconomic status. And for us in the UK, before 1960s, it used to be everything, including the opticians, the dental services. But with incurring debt and with the way NHS was growing up, probably because of increasing populations and aging population, they had to take off the optical and dental services of the NHS. So that only happens if you get free dental and optical services if you're 65 and above, or if you have if you're not able to pay, like if you're unemployed. So basically everything with us in NHS is free of charge. It doesn't matter who you are, even if you're not working, you walk into any hospital, you get treated. In order to avoid the use and abuse of the hospitals, we have the general practitioners, where everyone within a locality needs to register with a GP within their locality, and the GP are the ones to refer you to specialist hospital if needed. If you can't get access to a GP, or if you have an emergency, then there are two numbers to call. You have the 111 and the 999. The 999 has to be, let's say for example, somebody collapsed. It has to be like a proper emergency. 111 is probably like if you have abdominal pain on a Saturday, Friday, or any other day, then you call the 111, and you get to have like a triage system where they recommend maybe over-the-counter medication, or they recommend you to go to hospital, or they can even refer you directly to the hospital, or call an ambulance for you if you can't call an ambulance to pick you to the hospital. And the way NHS work and is funded is through taxation. So we don't have to pay directly or any earmarked social or health insurance, just like they do in Europe. Everybody pay a tax, and at the beginning of every year, financial year, the government brings out XYZ amount of money for NHS. And I think this year, over the past 2-3 years, everybody in the UK gets £27,500 every year for their medical care, everybody. So what that means is there are millions of people who will never go to hospital anyway because they are healthy and they don't need it. So their 27,500 will be used for those who are chronically ill, or those who need it at the point they need it. So because of the fact that everything is so free to the hospital, the healthcare is so free, some people do not appreciate the need to wait for weeks to have, let's say if you need a CT scan, if it's not an emergency, that can wait. It can happen in 2 weeks, 3 weeks, whenever you get a slot in the hospital to have your CT or colonoscopy or whatever done. If it's a cancer, let's say if it's a cancer care, for example, you have between the time you see a specialist, you have 2 weeks between the time you see a specialist to have all your tests done and probably start your treatment. So we get people who are not able to wait, or who do not want to wait, or who have enough money to pay for private insurance, and they pay for their private insurance, or they pay privately to get things done whenever they want it done. So in as much as NHS is there for everybody, 1 or 2 people decide they cannot wait the queue of NHS to get what they want to do, or they just don't want to, they prefer, or maybe like all these American companies, we have loads of American companies in the UK where they insure all their staff and get their staff to get some care privately if they want to, also choose to. But even then, those people can access NHS anytime they want to with no problems. If you're a visitor to the UK, you have to pay. In the past, if you're a visitor, you can access NHS without paying at all. These days, with so much cost from NHS, they're making everybody pay for it. You know, if you're a visitor, so we're tracking people down and getting them to pay. If you come to let's say if you come to emergency within the UK as a visitor, the first 24 hours is free. So whatever they do to you in A&E is free of charge. CTs, everything is free of charge. But the minute they wheel you to the ward, you start paying. So that's how it works with the NHS. And also with the NHS, you know, I know like if you hear the Americans say they want the NHS kind of health system. For me and to many of us working within the NHS, we know at the rate it's going is not sustainable. What I mean is not sustainable is money is never unlimited. No human being, no country, no nation has unlimited supply of wealth to sort out issues. So with the way NHS is, they have to start thinking about how to raise money and how to fund it. So far, every year we're having to have in the past, we could in the past, I'm sorry, the light is dim. We could in the past just get prescription at nothing. Now it's almost £10 per prescription, per drug, per prescription, because the government is trying to cut back money. So things are no longer as it used to be. And I know very soon we're going to be like France and other EU country where before you see your GP or when you see your GP, you have to pay like 1 or 2, maybe it's €10 or something. I can't remember. I don't know the exact amount of money. It's against how it is here. You don't pay anything at all to see your GP. So things are changing with the NHS, and yeah, even though it's free of charge now, I believe in the future they're going to make us start paying some form of money, even if it's £1, £2, maybe to see a GP or pay more with our medications. They've introduced a co-payment in terms of you pay £100 for a year, and whatever is in your prescription is free. People are assessing that, people are using that, but we never used to have that up until 2 years ago or even last year. So things are changing with the NHS. Thank you.
Dr. Hannah, thanks a lot for your presentation. We really appreciate. So people on the chat, though we've reduced the number, some people have left, but if you can still hear me, if you have any questions for Dr. Hannah or for the rest of the speakers that have already spoken to us, please don't hesitate to ask. Dr. Hannah, thank you very much. We really appreciate it. But please still wait behind in case somebody has some questions for you so that you could answer or shed more light about it. Thank you. So right now we have only 2 speakers left, and those 2 speakers they have very different time zones from the rest of us. One is in the US, one is in Australia. So their time zones are completely different. And so we got the recorded sessions of them. So the first one will be playing for us to watch is the session that was recorded with Dr. Uzoamaka. She's a nurse practitioner based in the US, and she's going to tell us about her experience with health insurance in the US. So what's going to happen is that I'm going to share my screen and I'm going to play her video with. So I'm going to play her the video interview session we recorded for everyone to see. Share screen.
Okay, thanks, Rebecca. Please, we'll just do 5 minutes of that video and the rest will be uploaded on our social media handle.
Okay.
Oh, yes, thank you.
All right. So I hope everyone can see my screen. So
yes, we can.
So
the volume is low though. Is there any way we can adjust it?
pardon? Okay, sorry.
Sorry, I can't still hear. I don't know if others can hear.
Pardon?
I can't hear her.
Oh, you can't hear her?
Yeah.
Yes, I can't hear her too, Ada.
Oh, okay. I'm so sorry. Share.
I think the volume is low.
Okay.
Same here. I can't hear.
I'm sorry. Yeah, I'll work on that. But can you see my screen?
Yes, you can see.
Okay.
The screen, but we can't
And
hear her.
okay. You're sharing screen. Yep. Okay. I'm playing the video. Can you hear her?
I can't hear her still. She's meant to be in church.
Okay.
I'm trying to reach her. Yes.
Can you hear her now? Oh, so you know what is going to happen? Because no, can you hear or the volume is low? Can you hear at all or the volume is low? If you can hear me, please, can you hear what the recorded session is saying, or is the volume too low?
No, it's too low. We can't hear her.
No, we can't. We can't hear her.
You have to go to the setting and do something about it. Go to the setting and increase the volume.
Okay.
Share sound. Share sound in the setting.
Share sound.
Engineer, while you're trying to sort that out, can you share the next video by
okay
engineer from Australia, please?
Yes.
Yeah.
While I'm trying to sort this out, I'll just play the other video. Can you see? Can you hear this video? Can you hear this new video or not? If not, I will just put the videos on the chat if that's okay.
Okay.
Okay. Because I'm having. So while I drop this on the chat, if you have any questions for the participants, please will appreciate that you begin to ask them, for the speakers rather.
Okay, while we're waiting for the questions too, I want to thank all those who honored our invitation today. This program is was as I keep saying, I started it just to educate my family members and my very close friends, you know, and realized along the line that they also had friends who they wanted to share with alongside their own family members. And then it kept growing. So as of today, we have 3 WhatsApp accounts. So we also have a Telegram account where we have members. But because of the way work is and all, I'm more at home with the WhatsApp profile, WhatsApp social media handle. And that is because at least it's on my phone. I can easily interact with members of this group. So the first group we started, that was some months ago, about, I don't think it's up to 3 months ago, has about 231 participants. We had to stop at that because some people left the group thinking that we're talking about female issues only, because we started with breast cancer, how to do the self-breast examination. So we left that some of the slots open so that if they want to rejoin, they will be able to do so. The second group has about 66 participants, which makes us 297, while the third group has 7 participants, which brings it to about 314 members of our group so far. So the idea of the WhatsApp group is to make it easy for us to share information. Yes. So we started with self-breast examination, modified it to something better with a breast form. And then today we are doing, this is the third meeting we are having. We're talking about health insurance. Today we've talked about health insurance in Nigeria, and then also how we can access healthcare in other parts of the world. Rebecca told us how she accessed health insurance when she got to France as a student. Today, thanks be to God, she's already serving as, working as an engineer in France. Dr. Wakwe Manse Hannah talked about health insurance in the UK. I would still want her to answer a question: how can a Nigerian access health insurance? Is there anything like international health insurance that you can access from any part of the world? So I would also like her to address that. Then Dr. Bata Stanley told us about how we can make our parents dependent, how we can also insure our parents, not just your children. I think that's a very beautiful angle to it. And there was something important he said. That was even why I invited Dr. Bata specifically for this meeting. One of these days, some months ago, he was very busy, was very, very busy. And he wasn't able to, stay with his parents at that time. And then he had this arrangement with a colleague of ours. He's also a doctor with a hospital very close to where his parents were living. And he told them, whenever my parents are sick, please attend to them. When I come back, I'm going to settle the bills and all that. And along the line, his mom was sick. She went to the hospital. In fact, the doctor who is meant to be taking care of the mom had to tell the mother, don't call your son again, don't worry. He has given me the chance to take care of you. Thanks be to God, the doctor managed the mom. She got well, got her discharged. In fact, he had a lot of time to go back and then sort out the issues. As he said, the teaching hospital where he has health insurance for the parents is quite far from where they live. So it shows us that you should have some sort of rapport. In Nigeria, the whole system is not really, everything we need is not really in place. And I thank God the NHIS member has also come to say what they are doing to make sure that every Nigerian is insured. So until we get to that point, do you have a facility nearby, a hospital nearby, a doctor who you can call on, at all times and at any time to access healthcare or to get advice, especially in terms of emergency? We know that in Nigeria, our emergency healthcare is not really where it should be as of today. And some of those relationships are very important. So with time, we'll get to know how we're going to go about that. Then we had the NHIS boss, the state coordinator for Lagos State, Ikeja branch, come in, Mrs. Aisha, and talk about the NHIS, talk about the gift ship, which is where we are at this point. And she's emphasizing the fact that you can access healthcare even as a private individual, even as a marketer, even as a trader. You don't have to be a federal or state government staff to access healthcare. My friend asked me when I told her about this program, I said, I thought NHIS or health insurance is only for federal government staff. No, Mrs. Asha has cleared the doubt. Then we have Chinoy coming in from Haja HMO. Haja HMO is committed to healthcare, and they were prompt in responding to our call to come and educate us, and want to appreciate them for that. So they are one of the top 10 HMOs in Nigeria. There are so many others, but in terms of response, I rate them number 1 because when I called them for this meeting, they were the first to respond. I'm also the HMOs that I reached out to just to come and educate us. So I think you know what to do with all the information you're getting today. Then we had Uzo. Uzo is a nurse in the US. She's a specialist nurse in neurology. She's also an engineer. She was my boss. She's actually my bosom friend. Did engineering here, electrical engineering in Nigeria before going to the US. And then she granted us an interview on how she assesses health insurance in the US, how it is beneficial to her patients, and how she has also been able to use it for her own children. During the interview, she said something important. She said she had a health emergency, which was going to cost about 18 to 20 something thousand dollars. Eventually, she paid only 800 because she was insured. You see how important that is, you know? And then she also said something, the interview will be posted on the YouTube, our YouTube channel later. It can't really be accommodated on the WhatsApp page. So she also mentioned how if you're earning less than, I think, $12,800 per annum, you are considered to be to be poor, so to say, you know, and then there's a special form of health insurance provided for you. 12,800 amounts to about roughly $1,000 per month. And I wonder how many Nigerians even end up to that. So, you know, it just tells us that if you have to pay 15,000, 45,000 per annum for health insurance, it's little compared to what, you know, is obtainable outside this environment. Then if you have to maintain any form of a relationship with your healthcare providers to make sure that when there's an emergency, you have somebody to call is also very important. And you pay little, next to nothing when you compare it to what happens outside this country, just to make sure that you don't come in emergencies. All right, so that is it so far. And then we had an engineer who is a colleague of our moderator today, who also, within a very short notice, he was called up yesterday. He responded yesterday, did a video for us yesterday, which will also be uploaded. And then he told us how he was able to assess health insurance in Australia. Unfortunately, the person who was meant to come in from India today is unavoidably absent. But I want to specially thank all those who, you know, made out time to be with us. They are very, very busy people. They are very busy people. But within 1 week, 2 weeks, 3 weeks short notice, and then even the engineer of yesterday, they all responded. I just hope that this meeting, you know, will be beneficial to everybody, and then we will seek out ways of getting insured and getting our family members and friends to be insured too. I'm a pathologist in training. I'm a senior registrar in anatomical pathology. Part of my job is to carry out autopsies. That is forensic pathology. And part of the concern too that made me start this group is not easy because I have to slot it into my very busy schedule of my routine work, childcare and all that. But when I see patients on the table when I'm about carrying out autopsy and they died of preventable causes that, you know, could have been prevented if they were insured, it's very hurtful. And that happens almost every week. Autopsy rates dropped recently because of COVID-19, but prior to this time, it was almost every day. You would see somebody who could have, you know, lived on your table just because she wasn't insured, he or she had an emergency and couldn't access healthcare at that time. By the time they finally come in, it's already late. So in order to prevent those happenings, we brought up this program of Health Hangout with Dr. Ada, and we are doing monthly meetings where we discuss different health topics. We have other health topics that will be coming up soon. Very interesting health topics. We are looking at talking about nutrition and different aspects of nutrition, pediatric nutrition for children, nutrition for diabetics, special care, or let's say chronic illnesses, type of nutrition that they should be exposed to or they should have to aid their health care. We're also going to be talking about addiction, how to break different forms of addiction. A lot of things are happening in Nigeria. There's one I heard recently on my class group, something water or whatever, you know, people are addicted to so many things. We're going to get there at some point. We also want to talk about what to do how to handle emergencies. If you have an emergency, you're eating and you suddenly swallow a bone or swallow something or something gets into the trachea, what do? Do you know? You know, if suddenly your child starts vomiting and stooling and the next hospital is about 10 to 20 minutes away, what can you do in the interim until you get to that hospital? These are topics that we are going to address as time goes on. We'll take it one topic at a time, one topic per month. So please, your own part, your own role to play is to invite your family members, invite your friends, if they can join us on the WhatsApp group, that would be fine because they can easily reach out to me on that group. I think that's the only social media handle that I'm very conversant with and it's very close to me. The others I'm just trying to learn because of time too. But our videos will usually be uploaded on the YouTube. So want to thank all those who have come today, and I'll hand over to Engineer Rebecca to take it off from here, and then we'll round up the meeting too. And I will check if there are any questions for us to address before we leave this place. Thank you very much.
Okay, thank you very much, Dr. Ada. So I don't know if everyone was able to get the recorded sessions because the videos I was supposed to play, I couldn't play it anymore because of audio issues. So I uploaded it on the chat, but I think some people are not able to download it. If you've seen the video, please can you just know that you've seen it, or if you've been able to download it, can you just let me know? Please, if you've seen the video or if you've been able to download it, can you let me know? Because I think some people, video not seen. Okay, apparently there are so many people that are not able to see the video. Can you check on the group chat? If you check the chat I sent at 5:21 p.m. I sent a video to the chat. If you go back to the chat, video not available. Okay. So you know what's going to happen because apparently it's a general issue and not everybody is able to have the video. So like Dr. Ada said, we're going to upload the video on the social media handles, and then we'll share the handles on the group chat. And also the video, we'll share it on the WhatsApp group chat. Now, when I'm talking about group chat, I mean WhatsApp group chat. So we'll share both the link to the video on maybe YouTube or somewhere and share the actual video on the WhatsApp group chat. So I'm sorry about the inconveniences that anyone might have passed through. So
the question, please, can Dr. Hannah take the question I asked about international health insurance? I don't know. I would like her to highlight. A lot of people travel to UK and India from Nigeria for health insurance. So I want her to tell us how we can, if I, anticipate, of course, everybody will get sick someday. If I feel that I should contribute to health insurance and access healthcare in UK at some point, can I start contributing from here? Is there any such platform? Thank you, ma'am. Please kindly unmute, ma. We can't hear you.
Sorry. Sorry. Yes, you can. I mean, many of these rich Dubai and Qatari and Saudi billionaires do come to the UK for healthcare, and they have insurance companies they pay to, and I've researched most of them, and to be honest, yes, you can speak to an insurance company or health insurance company in the UK, private health insurance company in the UK, and get them to cover you. And whenever you come to UK, you do your free health check, and they cover some other diseases. But many of them I know do not cover chronic illnesses. So if you're like hypertensive, if you're diabetic, for example, they say they won't cover it. Or if they have to cover it, then it has to be at a very exorbitant price. So that is very important. Then what other people do is they pay out of pocket. When they come to the UK, they get in touch with private hospitals and they pay out of pocket because they can afford it. But yes, there are insurance companies in the UK that can cover you, and there are so many of them. But I've looked through what they cover and how much it is to cover. They're very expensive. Like AXA, for example, AXA insurance, for example, they are willing to give you every cover, like everything you want, your dental, your everything, every kind of healthcare you want. But per annum, you have to pay, £5 million per annum. You have to be very rich to afford that. Then they have some other smaller packages where you pay £100,000 per annum, and that £100,000 per annum will cover maybe your blood test, your routine checkup. It doesn't cover inpatient, like if you're admitted, or if you're admitted, it has to be a certain amount of money. You can't go overboard. If you go over that, you pay out of your pocket. So there are many insurance companies that are willing to accommodate international patients. However, their premium is very exorbitant, even for me here, looking at what they have. So if anybody wants to come to the UK and for his or her own healthcare, I would say you speak to the different insurance company. It's all online. You speak to them. You shop. It's like a shopping. You shop around. You look at what they can afford, because many of them can afford X, Y, Z. Others cannot. So you find out what they can afford. You also ask, why do you want to be insured by them? You know, that's a very good question, because if paying 100,000 is just for you to come every year and do blood tests, I would say you keep the 100,000, you keep it in a separate account for whenever you need it, you know. And also we have like the Singaporean and some other Americans, they do these medical savings accounts. For my own, as to advise, what you can do is, if you have £100,000 to spend every year for your healthcare, I would say you can open a separate account where it would be earmarked for only your medical care. Whenever you come to the UK, you go directly to all these private hospitals. You don't need to book an appointment. Just call them on the phone and they book an appointment with you, and you go and they see you. Some collect as nothing. Some of them will say for your first consultation, they don't collect anything. Then you now have to pay for your blood test and everything, which is what I do for my dad. When he comes here, I book him to see a specialist or whoever they want to see, and they do blood and everything. It's cheaper for me, to be honest, because like blood test, you can get blood test for £80, £100, ultrasound for like £300 or £400. It's again paying somebody 100,000 a year, and all you have to do the same thing that other people would do out of pocket for like less than £5,000. So you shop around and you decide. Everything is all a company, because, and I also know that many insurance companies will write a blanket statement on their website. When you call them, they will be able to give you a premium that is tailored to you. If you say, let's say, for example, you're 40 years, your wife is 35, you have 2 children, you don't have any medical problems, they could say, okay, fine. I know the website says you pay 100,000, but for your own sake, just specifically for your family, you can pay us 5,000 premium every year. Then, but that will only be for XYZ. You come every year, you do your ECG, and once your wife reaches 45, they do a mammogram every 3 years. So everything all depends on individual. So there are so many insurance companies. If you want to come to the UK, you speak to them, tell them your conditions, and they will give you your premium. But I know the ones I've researched, they are so expensive. And if you have that kind of money, I'd rather whenever you need it, you come to the UK and you pay for it. And also, before I forget, some NHS hospitals also have private wing. My hospital used to have that, where you have private wings. So if you're a private patient, you call, you go to them, you call them and you say you have XYZ, then you speak to a specialist and they take you in and they admit you, or rather they run some tests on you. It's all on the hospital, and it's all hospital dependent. Some hospitals will collect cheaper than others. So like I said, it's all about shopping around and getting the best deal for yourself.
Thank you very much, Dr. Hannah. Dr. Ada, do you have anything to say?
Oh, well, I don't have much to say. I just want to thank everybody who has stayed till this time. We were about 32 at some point. Now we are just down to 16.
Half of us.
Those who have stayed on: Rebecca for hosting, Abigail, Abiodun, Anyachi, Doris, Flo, Grace, Dr. Hannah for speaking to us, Ifunanya, Inemesi, Josephine, Kingsley, Nonye from Hygia, Onyechi and Shoimo for being part of this. And for all those who attended this meeting, we want to thank you once more. Please keep in touch with us, be part of what is happening on the WhatsApp group and invite others. For the next meeting, somebody's going to sponsor some prizes for those who have the highest number of invitees and those who turn up at our meeting. So let's see how that goes. Thank you very much once again.
All right, thank you, everybody. So have a good evening and till next time. Bye.
All right, thanks. All bye. Nice time.
Thank you,
Thanks.
everyone. Bye.
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 Bye. Thanks for coming.
Anna, good to see you.
Thank you so much.
Bye.
Bye. Yeah. So I'm ending the meeting now. Okay.
Yeah.
Thank you.
Thanks.
Yeah.